Good afternoon, and thank you everyone for attending today's webinar, Medical Practice Revenue Cycle Management, presented by Todd Earhart of CloudTech. Please be aware there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the question box located to the right of your screen, and they will be answered in the order received during the question and answer portion. Additionally, an electronic version of this presentation will be emailed to all participants following the completion of today's webinar, and a recorded version will be available on the website for members only. Again, NJMGMA would like to thank you for attending, and I'll now turn things over to Todd.
Thank you, Alex. I wanted to talk today about revenue cycle management for medical practices, covering some of the unique issues that are faced today and some of the solutions that can be handled with those. And we start really at the beginning of the revenue cycle that, the need is to be able to get patients in your door. I've seen a number of practices where their patient base has been declining over time, and we need to understand some of the reasons for that, and the changes in the society today have changed. So I want to start by asking you a couple of questions. So why would a patient choose your particular practice over any others? What sets a practice apart from all the other practices that are out there? Now, I'm showing now a map that is a representation of a search that I did for a pediatric practice. And this is a search that was done for Plainsboro Township, New Jersey, for a pediatrician. You'll see a lot of red dots on this screen. And to get an understanding of the screen itself, if you're standing in the center of this map, it is 9 miles to the top, to the bottom, to the right, or to the left. So it's a 9-mile radius or 18 miles across. So if you had a practice that was in this map and your patient was sitting in the center of this, this is the number of choices that they have that finding a search on the web provides them. And again, it takes us back to those same two questions. Out of all the red dots on here, why would they choose one practice over another? Why would they choose where to go? But it also gives you a perspective about the fact that on this map, if you were to take a guess as to how many red dots are on here, if you guessed somewhere between 95 and 105, then you're correct. So on average, there's about 100 practices out there for them to be able to choose from. And how is someone going to be able to narrow that down to be able to walk in the door of your practice, which then increases the revenue and starts the cycle for your practice? And what the map represents is the fact that there's a ton of competition out there. There are more and more patients that are available to be able to go to see doctors and come in the door, but there's also much more competition in terms of practices and providers that are available. And it gives us some similar questions. How do you get those new patients in the door to keep your revenue cycle going? Because there's always an attrition. You're going to gain patients, you're going to lose patients. But if you're losing more than you're getting, then your patient base, like this pediatrician's office, was declining. And then once you get them in the door, how do you keep that patient coming back to you? So we need to understand that we're dealing with the millennial generation, which is highly different from other generations. They're very technology dependent, they're impatient, they're one of the highest educated generations, but they're lacking in social skills. And what would make this generation select your practice versus somebody else's? And it's the understanding of this generation and what they're going to do that's going to help us drive some of that business to your practice. Now, as with anybody, if you yourself wanted to find a practice to go to, if you have a referral from a family or a friend, that goes a long way in helping you determine what you want to do. But if you don't have that, today's generation, the young generation, they're going to go to the internet and they're going to do a search just like the one that I did. And they're going to look at websites and they're going to look at reviews. And these are important things because in that map that you saw, it was a map of Plainsboro Township, New Jersey. It wasn't Trenton, it wasn't Newark, it wasn't a large city. It was just a rural area where there were a lot of choices. And then when they do that search in Google and they want to do that lookup, where does your practice come up versus those other 100 practices that are potentially in the area? And these are keys to helping drive, whether that person is going to be able to find your practice. So one of the questions that people have is, do you have a website? And this is important because the young generation, when they go to do a search, they're going to want to find out information about your practice. They want to narrow down that 100 lists down to a few that they want to be able to check out and attend. If you don't have a website, unfortunately, a lot of the younger generation are going to just skip right by that practice and they're going to move onward. And even if you do have a website, the question is it easy to use? The younger generation might be searching for it on their phone. And if your website is very hard to use, it's cumbersome, it's not easy to work with, again, they're going to skip over that and they're going to move on to the next one on the list. It's actually recommended that if you do have a website that you have videos, because this generation prefers not to have to do a lot of reading, but they will gladly watch a 1-minute or 2-minute video which will tell them information about the practice, the staff, and the services that they offer. And they're also going to look for online reviews. And this is one thing to understand, that in the past it was very hard to get information about a practice, but now it's very easy. And even if you don't have a website, if you don't have Facebook or LinkedIn, unfortunately there can still be reviews out there on your practice, because there are places like Yelp and Yahoo where there can be reviews on your practice. Whether they're good or they're bad is yet to be seen. And all this information is now out there for this generation to be able to see. So it's also about controlling your web presence and understanding what reviews are out there, both good and bad, and it's critical to the reputation of the practice. The younger generation, as we said, they're very highly dependent upon technology, and I say the younger generation, but even someone such as myself, I'm in my 50s, and I'm dependent upon technology. It's basically runs our world, and a lot of people need to be connected to it. But younger patients want services to be made quick and easy. They would much rather, be able to interact with somebody through a text or through an email than they would through actually picking up the phone and calling. So they want services to be had out there, like patient portals, to be able to request appointments online, to be able to request prescription refills without having to actually call and talk to the staff, to be able to communicate with the staff. And it's also important, they can fill out some of their intake forms online. They don't have to actually sit inside the practice and fill them out for a long period of time. And then some areas where we're going to go delve into more detail, you can actually bill the patient through the patient portal, which is critical because it turns around the time and makes things easier for not only the patient, but for the practice and for the staff. You can receive your payments as well, and again, this is all about saving time for the practice. So it brings me back to that question of what sets a practice apart from another one. Why would that particular patient choose your particular practice? And the first things when we think about narrowing in on anything, whether you were looking to buy, an appliance for your house, or whether you're looking for a doctor's office, you're going to consider certain factors. The first is generally going to be location. And as you saw on that map, there was over 100 red dots there that were available for people. So the location of those practices doesn't necessarily set them apart from another. It just makes them accessible. The next one is usually going to be considered as price. Now, the typical patient understands that they have insurance, and with insurance, the price is governed by the insurance company. So what they pay, or what the insurance pays, is all governed, and it doesn't really matter to them. It's not necessarily true, because if I go see Dr. A versus Dr. B or Dr. C, if they have renegotiated their contract in order to get a higher rate, then price could matter, because the doctor would actually be receiving more and the payment could be higher. But being that they're governed by insurance, a typical patient understands it doesn't matter where they go, the cost to them should be the same. And this leaves medical services. So medical services can certainly set a practice apart from another. But with so many choices out there, as we saw on that map, it limits the field. So maybe instead of having 100 to choose from, if we really look at the medical services and their reputation, then that might bring them down to maybe 10%. Well, 10% of 100 is still 10 practices. So the question is, are you one of those 10 practices that they're now still considering, or are you outside that 10? And I want to give you an example here that's, tie it in after the end of the example, and that is, let's just say you want to get together with a colleague. You've been, you live relatively close, but you don't see each other often. You decide that you want to meet for lunch a few times to be able to catch up. So you decide to try some new restaurants in town, and, pick your favorite cuisine. It could be Italian, it could be Mexican. So you decide you're going to try one of those restaurants the first time that you get together. You get there, and unfortunately the staff are not that pleasant. Everything is very slow to get done. When your food finally does come, the food is excellent. But then on the other side of that, to be able to get your plates cleared, to be able to pay the check and get out, again, the service is very slow. It takes a long time. Then you decide to get together the second time, and you say, okay, let's try the second restaurant. You walk into the restaurant, the staff are very pleasant, they attend to your every need, things get done very quickly for you, you get your meal, and again, the food is excellent. Things have gone so well with the service that you decide you're going to order dessert. You have your dessert, everything gets taken care of, you get your bill, you get paid, you get out of there. So the question then becomes, if you're going to get together a third time, would you go back to restaurant number 1 or restaurant number 2? The food is the same. They were both excellent. But the customer service is completely different between the two. And generally most people are going to go to the second restaurant. They're going to go where not only they can get the food, but they can get the service. And this relates because in our example of the medical practice, when we narrowed down from 100 down to 10, we used the medical services. And think of the medical services as the food. So now we have 10 practices where we can get excellent medical care. But another area then that could help set them apart is customer service. So it's a new way of thinking, and I like to use the pediatrician as an example. So when a pediatrician has a patient come in, they generally have more than one person walk in their door. They could have 2-year-old Johnny who's not feeling well, and then they have a parent. Now, the child, Johnny, is definitely the patient. They're the one that need medical attention. But the parent as well cares very much about the services that Johnny receives, but they're not the patient. They are a customer. They're the one that's going to fill out the paperwork. They're the one that's going to have to wait with Johnny while he's not feeling well. Both in the waiting room and in the exam room. They're going to have to handle the check-in process, the check-out process. Now, if there's 10 different practices out there where they can get excellent service medically and also get excellent customer service, they're going to have to figure out who to go to. But if there's something out there, if they see reviews on the web that say, oh, we get treated very well. You know, the medical services are great here, but you know, you're going to be waiting forever to get anything done, or the staff are not very pleasant. That can now be a determining factor that can set that person apart in terms of which practice they're going to choose. So it's also getting the staff to understand that a person is not only a patient, they're a customer. So if I walk into your practice, I'm not only the patient, I'm also your customer. Because unfortunately, I don't know of many practices that you know, give away their services for free. You know, in the end, there is a transaction where funds are being paid for the medical services. And it's not just the medical services, but the entire process. Because there are so many choices, as we saw in that map, that can set you apart from another. And in customer service, it comes down to efficiency, ease of handling, as a payment, you know, how much do they wait in the exam rooms? Are the staff pleasant? And follow-up can actually be a critical thing now in a medical practice. So if I have lab work done, how, you know, do they get back to me, whether it's good or it's bad? You know, in follow-up in terms of prescriptions or follow-up appointments, you know, are those things taken care of? Because there are so many practices out there to choose from for all these patients, things that are also considered are convenience. We can look at things like location and parking. Is it easy to get in and out of? Can I park, you know, relatively close? Or did I have to park 2 blocks away and walk? How easy is it for me to schedule appointments, to handle prescriptions, for lab work? And again, do they follow up? Do they have a patient portal where I can handle things quickly and easily? And we talk about this because in order to increase the profitability of a practice, profit is, you know, determined as the amount of revenue or the money that the practice brings in minus the cost. So to see more patients will definitely increase revenue. But to increase that revenue with more patients, you have to be able to efficiently handle those patients with the same or less staff. It's also about reducing your costs. If you have to be able to see more patients because you want to increase the profitability of the practice, but you have to bring on more staff to do it, you may not be really providing profitability because you raised your revenue, but you also raised your cost. You want to look at things like your rejection rate. You know, if, you know, most businesses don't have the problem of a medical practice where you have to submit to insurance and then you need to get paid through that arduous process where insurance companies are looking for any reason to be able to reject the claim and to not have to pay or to prolong the process of payment. But all of that adds into the cost of the practice. The more that either your billing company or your staff have to follow up on a percentage of your transactions to get paid, that all adds into the cost of the practice. You also want to increase payment options because this allows you to get revenue quicker into the practice, which is important. We're going to cover that in more detail. And customer retention is something that practices should also be working on because it is cheaper to keep an existing customer coming back than it is for a customer to now be coming into the practice new. It costs a lot more to go out and get a customer than it is to retain a customer. And you want that recurring revenue. And I want to talk about the fact that the largest expense normally of a practice is the expense of staff, between salaries, benefits, training, time off, paying for office space. They are the largest cost generally of any practice, even over, you know, the cost of rent or mortgage for the building, you know, utilities. Generally the staff is the largest cost. And the more that that staff is doing, you know, menial, arduous jobs like paperwork and insurance verification, billing and collections, it becomes very expensive because of the cost of that staff. And the question is, how can you still provide excellent service if you're able to get more patients in your door with the same staff or less. And you really have to become highly efficient. You have to make things easier, not just for the doctor and the staff, but also for the patient as well. Now, some practices may be handling their billing internally. Some may handle it by outsourcing. If you were to consider outsourcing these services, there's a few things that you want to be able to consider. The first is to make sure that they're processing transactions. They're not processing your money. And what this is they can be submitting the transactions to the insurance company. They can be sending the bills to the patient, but all payments should be made directly to the doctor's office so that they're just processing the transactions and they're not handling your money. You also want transparency. You want to be able to have access to the systems they use. You want to have full reporting capabilities to be able to see where is the billing in the process. And this would be the same even if it's internal. If your own staff are doing it, you want to be able to see where the billing is at, how much is outstanding, how much has been billed, how much has been received. It would also be good to handle things from a full cycle perspective, from credentialing and contract negotiation. These are important because generally you can renegotiate your contract within 6 months of the expiration or renewal of the contract is the best time to be able to negotiate your contract. If you can increase the amount that you receive on a per patient basis from the insurance company, that has a big and dramatic impact on the revenue. Your claims processing and follow through, the balance billing, collections, all need to be handled within the process. And having a defined workflow with any company that you might work with so that you have processes in place, lines of communication to know that when something is wrong, how do we get it fixed? Who do we talk to? Whose responsibility is it? Are all keys in working with an outside company. Now, outsourcing can be cheaper than doing it in-house. As I said, staff internally, with what you have to pay for everything, they are expensive, and it can be cheaper to actually go externally. But in the billing, you need to look at your rejection rate. There are ways to be able to get paid faster. So, for example, in the leveraging the technologies of today, you can utilize billing right through the patient portal. And in this particular case, when everything is reconciled with the insurance company, you can actually then utilize the patient portal to say, hey, we've reconciled your bill. You send a notification to them through the patient portal. They get an email or a text on their phone. They log into the patient portal and it says, well, we've reconciled your last visit, and unfortunately you still owe $35. And this saves time because if you can send it through the patient portal, you're not paying staff to necessarily generate a piece of paper, stuff it in an envelope, seal it and address it and stamp it, and that entire manual process then can go away and be reduced down to a few clicks of sending it through the patient portal. And not all patients are going to be on the patient portal. And that's why it's important to have mailing services. There are services which can be used, again, to help with that process. So even those where you might have to mail a statement, you can send it to a service, and the service will be the one to print it out, stuff it in an envelope, and mail it, and do that manual labor instead of your staff actually having to handle the same thing. In terms of collections, having your collections integrated into your systems with your EHR, with your practice management. So when that patient receives the bill from the patient portal, what can they do? Well, in some patient portals now, they can actually just press a button and they can make the payment right there. And they're going to pay either via a credit card or an electronic funds transfer, and that is going to now provide the payment. But when it comes in, because it's integrated, what happens is it updates the patient account, it marks it as paid, it updates the account for the practice to show the funds have been received, And those are things now that staff don't necessarily have to do. So before, if you would have been receiving that payment in the mail, you have to send one of your staff out to get the mail, process through it, receive the patient checks, update their accounts manually, update the business account, and then get those checks ready to be able to be put into the bank. If this is something that can be automated, that person now doesn't have to spend that time doing that. It doesn't have to be expensive for that to happen. And that person's time, which is now freed up, can be used to better serve your patients, which goes back to that customer service. If a patient has so many practices to be able to choose from, and medical services will narrow the field, your customer service then can be what drives that particular patient to that practice. And also on the coding side, it's also good to be able to review the coding of the practice. There are services out there that will help you with reviewing your coding, because undercoding typically is going to cost you an average of 30% of loss of revenue. If you code one code lower than what you should, that's a 30% loss in revenue, which can drastically affect the practice. And there are services out there that can help you with you reviewing the coding that you've been doing, and they can tell you you've overcoded here, you've undercoded here, and they'll actually provide you with suggestions of how to improve your coding. And I wanted to talk about as well electronic remittance advice. Electronic remittance is the same remittance that you would receive if it was sent to you via the mail, except that it's offered to be sent electronically. It's a free service that's offered by almost all of the payers, as well as electronic funds transfer. And again, instead of a staff member having to take the time to receive these paper statements, post all of the funds into the system, and then deposit and process the check and everything, you can now be received electronically. It can now have some of that stuff done automatically for you, as well as, instead of that check, receiving an electronic funds transfer. Now, the electronic funds transfer is basically just a transfer of funds from one checking account to another. Think of it as like online bill pay. Same type of thing. Or when somebody works at, a particular company and they have their pay, automatically deposited, it's just direct deposit. Again, this allows a savings. And part of that savings allows you for quicker balance billing. You're more likely to get paid from the patient, and you're more likely to get paid quicker from the patient when they receive their balance bill sooner than later in the process. So if your payer is in California, it might take them 3 to 5 days to send it through the mail and get it out here to be received. And then it has to be processed and put into the system and a bill generated, and that bill might be sent in the mail as well. That's an elongated process. If you receive an electronic remittance, it can just be sent electronically. It doesn't take 3 to 5 days. You've cut down the time on the process. Because it can be processed electronically, it doesn't require somebody to necessarily manually process it and also process that check and update everything. It can, again, cut down the time in the process. The quicker you can get back that balance bill to the patient is the more likely that you're going to get paid, and you're going to get it faster. Now, the electronic funds transfer, as I talked about, is a payment from one bank account to another. It allows you to save time because there's less that needs to be done by your staff. The patient portal can have, these days, they can actually support not just a payment via a credit card, but also through an electronic funds transfer. And they can also handle what's called pre-authorized payments. So think about today's world. It's December right now, but in January, all the deductibles are going to be reset. And in doing so, there's a high probability that if someone visits the doctor's office, that ultimately they're going to end up paying the entire balance. And in doing so, you can also set up these pre-authorized payments, which is really just an agreement with your patient saying, look, if your bill is $100 or under or $150 and under, you're providing us with authorization to go ahead and pay that bill. And you can work out the amount with them, but instead of necessarily having to send them a bill, if it's under that pre-authorized limit, the patient can actually be billed via credit card or electronic funds transfer, and the practice receives the payment. And you're going to provide a receipt, of course, to the patient for that. And then anything over that authorized amount is something that then has to be dealt directly with the patient to be handled. But again, it can be handled through the patient portal. It can be handled by other means. Now, the reason I bring up electronic funds transfers is a reason that it can be very cost effective. Not just an electronic funds transfer from the payer, but also an electronic funds transfer from your patient as well. And the reason is credit cards typically will cost you a percentage. And if you think about the different payments, they can pay in cash, they can pay with a check, they can use a credit card, a debit card, or they could use an electronic funds transfer. And this younger generation, I happen to have a 19-year-old daughter. She does have her own checking account and savings account, but I can tell you that when she set it up, she does not even have any checks. She didn't want any. So she's not going to pay by check. She doesn't carry a lot of cash. The millennials generally don't carry a ton of cash. So they're not likely to pay via cash. And that means they're going to want to pay with some sort of electronic means, whether it's a credit card, a debit card, or an electronic funds transfer. And this younger generation, they don't like credit cards. Now, they will use a debit card, but even in my daughter's case, she doesn't really like to use it only if she needs to. But she loves online bill pay, which is an electronic funds transfer. And you can actually set up an electronic funds transfer with your patients through the different services that you can offer. And you'll see in this example, so at the beginning of the year, I'm showing examples of $100, $200, and $300. And typically, a cashback credit card is going to cost you on average of about 3%. The reason for this is, and I don't know how many of you know this, but a cashback credit card, the cashback is not paid for by the credit card company. It's paid for by you, the vendor, who accepts the credit card. What the credit card companies did is they basically changed everybody's agreement and said, if you are going to take our credit cards, you are going to agree to pay the cash back. So for Visa and MasterCard, it would typically cost you 2%. But if it's a cash back card, it might cost you another 1% or 1.5%. So if we average that out at about 3%, the cost on these values you'll see is $3, $6, and $9. So while the patient is paying $200, the credit card company is going to take $6, and the net revenue to the practice is now $194, not $200. Now, in an electronic funds transfer, it's a little bit different. An electronic funds transfer, the amount that's being transferred doesn't matter. You could transfer $5, $50, $500, even $5,000. Or you could even do $50,000. The cost of that transaction is the same. And in my case, for the account that I have, for my merchant services, it's 30 cents. So if we look at our $200 transaction, again, you're charging the patient $200 in the beginning of the year in January, but the cost that's going to be absorbed for that transaction by the merchant services account is 30 cents. That means the net revenue to the practice now is $199.70. That's a difference of $5.70 per patient visit that's actually visited. So if you can leverage technologies and utilize, these type of services, if you can even convert over 20, 30, or 40% of your practice to be able to utilize electronic funds transfers, it can actually create an extra revenue stream that you would not have had before. So each one of those visits now, instead of paying 3% of the cost, you're now going to pay just a flat fee. And most merchant services will offer you this capability. If it's integrated with your practice management and your EHR, that's great. If it's not, the merchant services generally will offer you ways to be able to handle it on your own, if you'd like. You can have someone log into a website and then process the transaction right there. So if we're successful in being able to drive this generation to the practice, and we're able to bring in more patients in order to generate more revenue, we need to be able to handle it. So we have to look at the efficiencies of the practice. Because as I said, if you bring in more patients, which brings in more revenue, but on the other side you have to bring on more staff to handle it, both your revenue and your cost have gone up. Your net to that and your profit is not necessarily where you want it to be. So in looking at those efficiencies, practices need to look to leverage the systems of today, where in patient check-in, insurance validation, intake paperwork can be streamlined. There are systems today now that are connected to the health insurance companies. You can just have your staff type in their ID number for their insurance, select their insurance company from a drop-down. It will go right out to the health insurance company. It will come back and they'll give you enough information to tell you, yep, that's the same Todd Earhart that's standing in front of me. Then you can press another button, and at that point, it's going to bring down my patient demographic information, my name, my address, my telephone number, etc. It's going to bring down, and it's going to validate my insurance. It will tell you my copay, my coinsurance, my deductible, and even importantly, it will tell you how much of that deductible has been met. And it can even tell you what services are or are not covered as part of that insurance. And if you think about that process, when you actually execute it, takes about 30 seconds. Now, it actually just took me longer to explain that process to you than it would for you to actually handle that transaction. But if you had to do all of that manually, to make a phone call to validate the insurance, to type in the information, it becomes very expensive because it's the staff's time to be able to do that, but also the patient has to wait throughout the entire process. We've also reduced the paperwork because some of what was just downloaded from the insurance company is paperwork that the patient now has to fill out, and it's also information that the staff now either have to type in or scan into the system. The rest of the intake paperwork can actually be put online as part of the patient portal, so they can fill that information out ahead of time. It'll come in and be attached right to their chart. Again, streamlining the process for the patient and for the staff, which again, the cost to the staff helps to save money. And in this process, they can even bring down a prescription history for the patient. This is important because 70% of patients, on average, do not remember their prescriptions. They don't remember the name, they can't pronounce the name, or they don't know the dosage, or a combination of both. And this can give you a history electronically of their prescription information, which allows you to know what that is when they say, well, it's a little yellow pill, I don't remember what it's called. In these efficiencies, you want to get rid of the amount of time that the patient has to wait. You want to have ease in the scheduling process and convenience all the way around, because again, the medical services are going to reduce down the choice of practices, but because there are so many to choose from, that the scheduling and convenience is part of the customer service will set your practice apart from another practice. The same can be said in the exam room. How easily are things handled? How easy is the charting? Good systems today can help the doctor and the staff to be able to do the charting in an average of about 90 seconds or so. Or if you're using a system that's very long and arduous, remember, it's not only necessarily hard for them to do the charting, but the patient's sitting there waiting during that time. And this can all go towards the feedback or the reviews that are out on the web. How easy is it to handle prescriptions and lab work, and how long do they have to wait? Again, at checkout, how easy is it to handle the prescriptions? Do I actually have to drag Screaming Johnny into a pharmacy with a prescription blank to wait and get it filled, or can the prescription be sent right to the pharmacy and then I can just drive up to the drive-thru while Screaming Johnny's in his car seat and I can just pay for my transaction and be on my way? How easy is the lab work handled? Systems today are connected to labs as well. They allow for the lab work, the order to be sent right to the lab. So if I'm the patient, I go there, I show my license, they've got my prescription already, I get my test done, and then the results can actually be sent right back, and good systems will allow for that. I've seen systems where there'll be a red button that will now start to blink. And someone in the staff is going to see that blinking red button and say, oh, somebody's lab work has come back, I need to address that. So they can go and look at it, and then they can determine, was it good, was it bad, what steps need to be taken. How easy is it to process the payment? We talked about some of the different payment options. How easy is it to make an appointment for follow-up? Some of these things are important because this younger generation, they think Facebook is social. It's not really, it's listed as a social media, but it's not all that social. But they would prefer to have an automated way to make appointments. They don't want to make a phone call to a practice. They don't want to have to be waiting on hold. They would much rather schedule it online through the patient portal or through a website to be able to handle it. On the claim side, again, the efficiency. If we're getting more patients in the door, we're getting more claims. What is the accuracy of those claims? Being able to have that connection to the insurance company allows the fact that, remember, my patient demographics can now come down. The way that helps is instead of somebody typing it in and they typed my name wrong, it's very common I'll receive a piece of mail where somebody will put a D in my name. Well, if you do that for the claim, it's now going to be rejected. But if the information came down from the health insurance company, and then when we process the claim, that information is sent right back to the health insurance company, there's no chance of getting it wrong. We're reducing the opportunity for error. And then in the filing and the rejection rate, remember that once the claim is submitted, you only have a certain period of time, a window, to be able to get that claim processed successfully. After that window, you're no longer going to be paid by the insurance company for that claim. There are a number of things that can be done to help reduce that rejection rate, like getting the connection right to the payers to be able to get that information. You also have to be careful and understand there are different companies you can deal with for your clearinghouse. The clearinghouse is when the claim is processed electronically. Aetna versus Blue Cross Blue Shield versus someone else, they take their forms in different electronic formats. So you send your claims electronically to the clearinghouse. The clearinghouse then says, okay, these are for Blue Cross Blue Shield. We'll format them the way that they want them and we'll send them off to Blue Cross Blue Shield. The same for the other payers. But clearinghouses are getting better, so you can look at different clearinghouses that you can use. Some of them actually have edits in them, and they can tell you that, oh, by the way, we got these 10 claims from you, but these 2, we're rejecting them at the clearinghouse. We're not even going to send them to the insurance company. Why? Because we already know that they're going to fail. So leveraging the clearinghouse's technology to be able to do this helps in a number of ways. It allows you to find errors before it even gets to the insurance company. Because remember, if it made it through to the insurance company, it gets rejected, that window of time is now clicking. But if the clearinghouse rejects it for us, that window of time hasn't even started because the insurance company hasn't even received it. It allows you to fix it and get it corrected in order to help things flow better when it gets to the insurance company, to help it get through in order to be able to get your payment. The balance billing, we've talked a little bit about the cost of that, handling the balance billing manually, and dealing with the paperwork being sent into the office or being sent out. You're paying your staff to be able to do that becomes very time-consuming and costly. Look at ways that you can reduce that by offering different payment options, by utilizing services like some of the ones that we talked about in using mailing services instead of having your staff doing it, signing up with the payers for electronic remittance and electronic funds transfer, and also offering services like the patient portal to help reduce that turnaround time and make it easy. People like my daughter who might come into your office, if she was to receive a message through the patient portal, she would have no problem having something already set up with the practice, so she can just press that button on this portal that says, make my payment now, and everything gets taken care of. And on the collection side, understanding that, I can tell you, from my experience, my insurance has no deductible. So basically, when I go into a doctor's office, I have no copayment, and without having that copayment, the services have to be rendered in full, and the doctor's office actually doesn't receive anything. They have to bill my insurance and go through the process, and then later balance bill me for the difference. So handling those collections is a key process to be able to make that quicker, to make it easier. And you want to be able to get those payments, offer those different services to make it easier and make the process quicker to turn around. And you also want to look at when you do have a patient who has received a bill and they haven't paid, what are the options for collections? You could go to a collection agency. They're usually very nasty in their process, and you're going to lose that patient. If you want to be able to keep that patient coming back, there are other methods out there that you can utilize in order to do those collections, some of which can even be integrated with your practice management so that they can be handled easily. And one of the things that's important, as I stated earlier, some practices that I've worked with have seen that their patient base is slowly declining. They're losing patients more than what they're gaining patients. So retention of patients becomes a critical part in following through. That's why we talked about the customer service. You want to establish a relationship with them because it's much cheaper to keep that patient and have them coming back than it is to go out and get new patients. So establishing that relationship, having the follow-up and the follow-through is also critical. Sending out reminders to them. Some of the systems today that you can utilize can help you provide reminders. Little Johnny's due for his next vaccination, or the fact that somebody has, it's time for your yearly visit. It's one of those things where it's out of sight, out of mind. I forget about it, but if you provide that reminder to me, I might sit there and go, oh, and that's now going to bring someone back into your office for that recurring revenue which you're trying to get. And when you're dealing with your patients, especially when they're happy, you want to ask them for referrals. It's okay. I mean, in all kinds of businesses out there, they will talk to their customers about referrals. If you know of anybody who might have a need for us, please do so. Or they can ask for a testimonial. Testimonials are good things because when that person who's looking for a doctor is going out there on the web, as I said before, you might not have a web presence, or even if you do, it depends on what's out there. But there can be reviews, both good and bad, that are on things like Facebook or LinkedIn. The problem that you have is if you're on Facebook or on LinkedIn, you don't have control over whether someone leaves a testimonial if you allow that to be able to be done. But again, it could be good or it could be bad. Your website, you have total control. So what some practices are doing today is they're asking patients for testimonials, and then they're giving it to their people who manage their website to publish that testimonial on their website. Your website is under your control, so you can help make sure that your web presence on your website is positive and that you have good testimonials out there for those people to be able to see. And it's always good for the practice to be able to either host classes or be involved in community events. Again, the visibility becomes a good thing to be able to be seen, so that when they're scrolling through that list in Google and they see the name and they say, oh, I saw them, at a recent event, it makes them think about the fact that, they'll consider that practice versus someone else. These are all things that can help to set you apart from other practices when someone's considering looking for that practice. So we want to leverage positive changes, looking at your EHR and your practice management. You could look to get more patients in the door, but in order to do so, you have to be able to handle them efficiently. We talked about the claims processing and what they call denial defense, where the clearinghouse can help you clean up some of the claims in the process. Offering services like a patient portal and having a website are critical to getting this younger generation, the millennial generation, to actually see your practice and to be able to look at it and consider it, to narrow it down so you can be one of those 10 that they're looking at out of the 100 instead of being dropped off that list. And then even in the, once you are within that 10, you want them to be looking at your practice and not someone else's. So as they weed people off that 10, you want to be remaining on that list. So being able to get more from your staff but still provide top quality service is the key to being able to handle more patients and bring in more revenue and to drive those patients to your practice. That's all that I have for right now. Are there any questions out there?
We don't have any questions right now, so if anyone has any questions for Todd, please type them in the question box, and we'll just wait a minute and see. If nobody has any questions, we'll wrap up the webinar, and we thank you for attending, and the webinar will be sent out to the attendees and available on the members only section of the website. Okay, doesn't look like we're getting any questions in, so thank you so much, and we'll be sending out the webinar.
Thanks everybody, have a good day.